Dr. Mudley.
Yep.
What is metastatic breast cancer?
Metastatic breast cancer is the process by which breast cancer spreads from its primary site, which is the breast, to another organ system. Now, that organ system can be literally anywhere in the body, but it's typically organs that are the lungs, the liver, the breast, the bones, and maybe the brain. Now, you will notice I said the breast because sometimes it can spread to the other breast. That's not normal, but it's some things that patients are often concerned about. So when stuff is called metastatic, it means it's spread past the original organ, and it's the same as calling something stage 4.
Okay, thank you. Dr. Ramdas, what is the goal of treatment?
So firstly, what is palliative care? So palliative care it's an approach basically that helps patients and families try to deal with terminally ill illnesses to get them through. And if you're looking at that, then the goal of palliative care will be, one, to improve pain, to improve symptoms. It's also to deal with certain anxieties and problems that the patients have, fear, dealing with the process of now going like dying, death and dying, helping the family, sorting out affairs. So those are all palliative care processes, and that's the aims of it.
Okay. Kiara, how could one prepare for treatment and recognize and manage any symptoms afterwards?
I normally tell the ladies, wait till they start treatment. First wait to see symptoms that you might be struggling with and that, and then you can look at complementary therapies if it doesn't interfere with your treatment to help you through it.
Okay, thank you. Dr. Mudley, what are the treatment options for metastatic breast cancer?
Well, they're numerous. Okay, so you must remember that the treatment of breast cancer has 3 main components. So it's surgical, it's radiation, and it's systemic. And each one of those things are used when managing metastatic breast cancer. And then you say, if you take the systemic treatments, they are either hormonal or chemotherapy or biological therapies. Each one of them has a whole host of therapies that fall under them. So in a nutshell, if you're a metastatic breast cancer patient and we were to count the lines of treatment we can give you, they're usually in excess of 10. Okay? So that means patients with metastatic breast cancer can indeed expect to live quite a long life. So it's not one of these cancers, if we tell you you're metastatic breast cancer, that your prognosis is pathetic. Far from it. Actually, what you should know that in metastatic breast cancer, the prognosis is quite good. You don't die from this disease quickly. But in the same breath, you need to manage this so you get that longevity in survival.
Okay. Dr. Ramdas, how does a metastatic patient deal with the fear of one's own mortality?
It's a very difficult thing. It's extremely difficult to get the patient to deal with it, because the patient's not only dealing with his or her fear, they're dealing with the fear of everything. The fear of leaving the family behind, the fear of having burdening the family with the fact that now they need to go for treatment daily, they're going to be sick, they're going to need care. So it's a very, very in-depth process when you look at dying. You've got to take the patient through it. It's like grieving before the death, basically. So they go through the stage where they will have fear in them, and it's like fear of, now I'm going to die, I'm going to leave behind this person, I have dependents, I have all of that. So you have to deal with that. Then you take them to the anger stage, because they have every right to be angry. They're angry at the fact that I'm going to die. They're angry at the fact that, why did this happen to me? I didn't ask for that. So they have to go through that. Then it's also the anxiety behind everything that you need to deal with. And it's important for them to seek counseling very early when you know the process of dying is right there, terminal care needs to be brought in, so they can deal with these fears. And also it's important for them and the families to deal with this together, so everyone's on the same page. Because most of the time the patient just withdraws and keeps everything to themselves, and then they start pushing the most important ones, the loved ones, the ones that are most closest to them, away, because they feel detachment early is important. And we need to reiterate to patients that this is not how it should be. This is the moments when they should actually spend more time with their family, and they should deal and accept together. So it's like you're grieving the death before the death happens, and that's how you need to actually take go with this, and you need to deal with this with the patients. So So psychological support earlier on rather than later is very, very important, along with the treatment and along with everything. I always believe that. And one of the most important thing that most people forget when somebody is dying is all the paperwork, the litigate, the legal stuff. And we forget that a lot. We forget that, and then when the person dies, then all of this just falls onto the family. And we also need to bring that into thing with the patient.
Okay, thank you. Kiara, what is the difference between alternative and complementary treatment?
Alternative is when you refuse the treatment that your doctors have recommended, like chemo, radiation, and you decide to rather use natural therapies, which can range from energies to different herbs and stuff. But alternative therapy, there was an article published saying that women with breast cancer that use alternative therapy increase their risk of dying sixfold. And it should rather be about complementary therapy, that you add things to help make your treatment better or easier, and it shouldn't be anything, once again, that interferes with any treatments that your doctors advise.
Dr. Moodley, the question that everyone is too afraid to ask, am I going to die?
I'm often facetious about that question, because we're all going to die. None of us are here forever, but we all live like we're going to live forever. So it's actually a bit of a strange question. Yeah, metastatic breast cancer is associated with a finite outcome. So by that I mean, at some point, this disease that you have, that it's going to get you at some point. So we know that for metastatic breast cancer, 9 out of 10 times, that disease process is what will ultimately result in your death. But that's not now. That's way forward in the future. And in many patients, when properly managed, that is years from now, 5+ years from now. So even in that scenario, it gives patients in that space time to be able to come to terms with this, time to be able to do what they want with whatever time they've got remaining, be it a little or a long time, and time to actually make peace with that process. Of course, that's fine if you're older, but that's a mission if you're younger. And these are the things that we need to manage in that continuum.
Okay, thank you.